Alrighty, let's see. Looks like people are quickly joining, and we do have a jam-packed schedule, so I'm going to go ahead and jump right into today's session. Good afternoon, everyone. Thank you so much for joining us today for our 20-minute Benefits Buzz Virtual Primary Care, a year in review. My name is Emily Kunish, and I'm the Senior Marketing Manager here at First Stop Health. A few things to note before we kick off today's event. Today's session will be recorded and shared in a follow-up email sometime early next week. Should you have any questions, feel free to drop them into the Q&A, and we will do our best to get to them at the end of today's session. However, if we do not have time, we will share the answers in the same follow-up email. Alrighty, so now that housekeeping items are taken care of, I am pleased to introduce you to today's presenter, Elena Gambin, Chief Strategy Officer and Chief Growth Officer at First Stop Health. Elena, would you like to take a moment to introduce yourself before we begin today's buzz?
Absolutely. Hi, everybody. Thank you all so much for joining. I am thrilled to be here with you today. As Emily mentioned, my name is Elena. I'm the Chief Strategy and Growth Officer at First Stop Health. And I will kick us off and let everybody who is new to First Stop Health know that we are a virtual care company serving over 750 clients and 750,000 members nationwide. As well, for those new to us, at First Stop Health, we deliver virtual care services across the behavioral and the physical health spectrum. So we have 3 service sets: virtual urgent care, which is 24/7 access to MDs and DOs for minor illnesses and injuries; virtual mental health, which is short-term solution-focused counseling based off of cognitive behavioral therapy; and our newest product, and the topic of today's presentation, is virtual primary care. So when we think about virtual primary care, it really is the expansion of what virtual urgent care has done in the past, and building off of the success that we've been able to gain in terms of employee engagement and utilization, which is industry leading. But we're enhancing the service to focus on creating long-term trusting relationships between a patient and a virtual provider. 2 is a focus on adherence and closing gaps in care. And 3 is leveraging true navigation and care coordination so that care paths, even when virtual care ends, can be informed by and supportive of the benefit structure that an employee and their family are navigating through. So our goal for today is to talk a little bit about that virtual primary care service, give you an overview of the solution, share some of the results that we've been able to achieve in the last year, since we are coming up on our 1-year anniversary here, and also give you a look forward into our product roadmap and share some of the enhancements that we've implemented already and are implementing for the 1/1 of 2024 benefit cycle. So if we flip to the next slide, before I describe what we do, I want to tell you why we do it. So we recognize that there is a pretty significant issue in the current landscape primary care, and it really is care, let alone in person. The common statistic that you might see in the market is that about 60% of US adults either do not have or have not seen a primary care physician in the last 2 years because of barriers to access, things like cost, provider shortages, patient inertia. The second problem, though, is if a patient is going, so even if those 40% are going, often the primary care physicians that they are seeing are misaligned with patient needs because they are operating out of a fee-for-service environment that prioritizes volume over value, number of patients over time spent with a patient, and often increases the number of unnecessary high-cost referrals because of hospital ownership. And we really feel like this can lead to poor condition management and less trust and fewer touch points between a patient and a provider. So we know that primary care, when delivered effectively, has the incredible potential to decrease mortality and morbidity and improve a patient's sense of efficacy and actualization in their own health. But it is not currently being delivered that way. So I want to introduce you to a new concept of how we might change this landscape and how we have been changing this landscape for our patients on our primary care platform for the last year. I want to introduce you to a patient by the name of Naomi. She was an actual patient of ours, de-identified, of course, and this is her story. So Naomi was a patient who actually initially came to us because we had been outreaching to her and engaging with her in a way that resonated with her. She remembered that she had our services and gave us a call. Within 3 minutes, she was in a virtual room with one of our physicians, received a prescription for a topical generic steroid that was sent to her local pharmacy, and she was undergoing treatment within an hour. That's a successful diversion of an ER visit, pretty successful, typical telemedicine experience. But we knew more about Naomi because of how we interacted with her that allowed us to continue that relationship. She let us know that she was reporting high levels of anxiety and stress, that she has a family history of high blood pressure, and that she has not seen a primary care physician in not only the last 12 months, but actually in about 5 years. So we reached out to her to remind her why primary care would be an incredible tool for her. She made a visit with one of our physicians, Dr. Hippen. 2 days later, that visit lasted 30 minutes, during which she discussed her last diagnoses, some of her recent concerns, and Dr. Hippen took a proactive approach to let her know that she was due for a mammogram and a pap smear, and that we would be able to support some of her anxiety and her stress concerns, both from a pharmacological perspective in-house, as well as by getting her to a really great counselor that was in network. We sent her some follow-up items to help her better manage her health, including a blood pressure cuff so that she could regularly check her numbers, and some recommendations for that mammogram and that gynecologist. And lastly, because so much is happening now with Naomi and her doctor, she needs little reminders of how to act and when to go complete her care path. So we did adherence checks, reminded her that it was important to schedule her mammogram if she hadn't yet, and any labs we had ordered for her to go get them so that we could have a better picture of her health. This is a typical patient experience with us, and the things I want you to notice about this that are markedly different from a normal primary care experience are that A, we have to be extremely proactive for Naomi to engage with us, not just at the beginning, but at the end. And she initially came to us because she had a concern about a rash. So we have to think about patient behavior and patient motivation, then guiding them into a healthier relationship with a provider for us to move the needle on the first problem of primary care engagement, and B, the second problem of a high quality management system. So if you were to summarize what this looks like, this next slide really does that for us, which is primary care is so much more than just clinical care. It really is a virtual medical home, with one prong of this three-legged stool being clinical care, one being true care coordination, and the last being around engagement, which is more than just initial utilization. It's also adherence, and it's also follow-up. So we're going to quickly double click on each of these areas, starting with the clinical care. And what I'd like to highlight for you here are some of the ways that our patients use the clinical components of our service. So as I mentioned, primary care includes access 24/7 to our urgent care providers, because when you have a rash or a UTI or need to know if you should go to the emergency room, you need that help right now. But it also includes long-term relationships with providers for chronic care and prevention. Chronic care is true disease management for things like diabetes and hyperlipidemia. It's support for ongoing issues and symptoms that maybe aren't in a chronic disease category, but that you're concerned with as a patient. It's treatment management for high acuity conditions that also involve maybe a specialist, where our primary care physicians are quarterbacking care. A great example of this would be oncological treatment. Another great example would be anybody who needs MSK support in the form of surgery. You still need a primary care physician quarterbacking some of those higher acuity episodes. And on the prevention side, it's a combination of focus on closing gaps in preventive screenings, age and gender screenings, as dictated by the United States Preventive Service Task Force, as well as understanding a patient's baseline health state from vitals and biometrics, improving them over time, and their lifestyle and well-being goals, like sexual health, sleep, nutrition. The biggest arm of this bucket is mental health. 40% of our patients in primary care are coming to us for mental health concerns, and you'll see in a couple of minutes that anxiety and depression are the top two conditions that we see in primary care. The second kind of leg of this stool is around coordination. I want to highlight here that coordination and steerage really involves creating a streamlined process for referrals for patients to interact with in-person or in-network care, or the benefits that they have access to once a virtual visit has been concluded. If a patient either asks for a referral or a doctor recommends one, we review clinical appropriateness to make sure that we are not contributing to unnecessary referrals, but then we will help steer a patient to a high quality, low cost option that is in network and meets a slew of important criteria, including availability, quality, cost, proximity to the patient, meeting preferences from the patient's perspective, language requirements. And then we close the loop. So not only ensuring that the care is in fact completed, but collecting either automatically into our EMR or manually as needed, the results for a complete picture of the patient experience. And last but not least is engagement. So we think about engagement as a function of both getting that first visit, but also adherence and follow-up. Our engagement is a combination of automated and personalized outreach that is customized and continuous. This engagement is fully organized and implemented and funded by First Stop Health at no cost to our employer partners. It takes the form of introductory messaging across multiple modalities, be it worksite kits, on open enrollment support, home mailers, emails, SMS messages, ongoing messaging that is persona and event-based and customized by the person reading it, and clinical outreach for things like reminders and result returns so that a patient and their doctor or a patient and our nurse team can become closer and work towards health goals together. Engagement matters because primary care that is a high engagement primary care effectively acts as a buffer between patients and the health plan. It's a virtual first environment, and that buffer is savings. We guarantee 30% utilization because we know how important that buffer is. That savings buffer comes from immediate cost diversion due to triage and better site of care choice, earlier and better prevention, better chronic disease management, and general patient decision-making that is improved and informed by a care provider. So if you think about why our clients have chosen to partner with us from a virtual primary care perspective, it's really for three reasons. Number one, because of how our model is designed and because we financially guarantee it, people actually use the solution at industry-leading rates. And in the case of primary care, we specifically excel at helping hard-to-reach populations use this. So thank people who have not seen a primary care physician before. Second is because of the experience. Virtual care delivered quickly and at no cost to patients, and in an environment of trust and love, improves access. And in VPC, we go a step beyond that to help patients improve access to in-network care through our steerage platform. And lastly, this decreases costs to the plan and to the patient. Our program is so highly utilized, it is truly a first stop for people. And we're able to effectively deliver a return on investment average of 114% for our clients. For every dollar they spend, we are seeing $2.14 in savings, making this meaningful not only for the patient experience and better health outcomes, but plan cost as well. Let's take a deeper look at some of the numbers we've been able to put up. We have about 50,000 employees and 100,000 members on our primary care platform today. Some of the top conditions we treat are called out on the right-hand side of the screen. I'd like to call your attention to the prevalence of mental health conditions here and metabolic related disorders, including obesity and diabetes. We found actually that the patients on our platform index a little bit higher on the acuity spectrum than we had originally hypothesized. And we're working to make sure that those in a state of wellness are also excited to use this program. Interestingly, 50% of our patients are new to primary care. From an adherence perspective, we're tracking at a 66% lab completion rate, hoping to increase that over time to above 80%. And less than 25% of our visits result in a referral, which is important because we want to minimize unnecessary referrals, but drive effective referrals when needed. Through our partner and the data that we use to create that steerage, care paths starting with our recommendations cost on average 26% less than the market. And my favorite stat is that we have a 96% 5-star rating. Patients enjoy the doctors that they work with. They see, on average, they are scheduling new appointments within 5 days. Typically, they have a next day appointment available, but it is an extreme convenience and patients feel seen for the first time. You can kind of see this on the next slide, some of the results that we've gotten from a user survey that we've generated. 42% of patients say they use this service because of its convenience, and 23% because of a strong incentive. Visits not only met expectations, but felt that they were easier and quicker and sometimes better than an in-person visit. 94% of our patients would use it again, and 96% would recommend it to coworkers. The other part of the survey that we reviewed was targeted around understanding motivation. We've developed primary care personas to support our engagement strategy, just as we have done with the rest of our services. And interestingly, there are really two types of primary care patients on our platform. Those that are health-driven with consistent need likely have a primary care physician, but are struggling with the existing ecosystem due to a lack of convenience, cost, or time. And those that are healthcare avoidant, who are not using the system today because there's a lack of trust and a lack of accessibility. So we want to convert those both negative experiences into positive ones. And as a testament to that, we've received feedback on the next slide from a number of patients that is overwhelmingly positive. And the thing I like to call out about these quotes are the most resonating theme is, I have never felt this way before, or this is the first time I felt seen like this in a healthcare environment. Patients are currently experiencing less, and we can do better. My favorite quote on this is, I have never had such a hands-on healthcare experience with any other doctor in my 57 years. And to close us out, I wanted to share with you some of the enhancements that we're creating for our primary care platform. In the interest of doing better, we're continually iterating. We think a lot how we can continue to enhance our service, not just for the patient experience, but to prove to our employer partners that this is making a meaningful difference. So the first project I'll talk to you about is smarter engagement. These new VPC personas that I mentioned to you are partnering with smart product routing so that when a patient comes to our platform, we get them to the right type of visit the first time. Many of our urgent care patients actually should be primary care patients. And so we think a lot about how we can improve the way that patients select activities and help steer them to the right care that they need. The second is language capabilities. We already offer multi-language capabilities across our services, but we recently are rolling out our app and our website in Spanish, and we're continuing to expand our provider network and capabilities in the language arena. We're also working on improving our population health reporting. So we want to be able to demonstrate improvement over time in discrete health metrics like hemoglobin A1C or BMI or weight. And we want to be able to actuarially validate our savings methodology on the ROI of urgent care as well as primary care. We're also working in constantly improving the data that we use for our steerage. So I referenced before a 26% less costly care path when one of our recommended providers is used. That is informed by 13 billion points of claims data through our channel partner. And they are helping us better understand how to steer patients to high quality, low cost care. And lastly, we're working to integrate our services with IoT devices like durable medical equipment, health kit on Apple for Fitbit or other data tracking devices, so that our providers can have more information about the vitals of our patients, and our patients can feel like it's a whole picture of health when they log onto our app and interact with our care team. So thank you all so much for joining this webinar today. This is just a summary of kind of how we think about our primary care program to date and a sample member experience. If you have any questions and want to put them in the chat, we're happy to follow up at a later time to answer those. And if you do want any information or to speak with one of our folks directly about a client, very happy to have you do that. And we'll send out the information that you need so that you can reach out to us directly.
Yes, thank you so much, Elena, for an incredibly insightful presentation today. We are at the top of the 20-minute mark, so just to be respectful of everybody's time, we will go ahead and close out today's 20-minute benefits buzz. Stay tuned for August. We will be focusing on the power of employee engagement then, and we hope to see you there. Have a wonderful rest of your day, and thank you so much again for joining. Take care.